Has your child just had ear tubes placed? Currently doing okay, but have some questions? Hopefully this video can answer some of the typical questions that you might have after ear tubes. Welcome to SnotDoc video series. My name is Dr. Stephen Chase. I'm an otolaryngologist out of St. George, Utah. To answer questions you might have after ear tubes, I want to start talking about the anatomy involved. Then we'll discuss pain management. I would also like to discuss a couple things that you might see, specifically drainage or even potentially bleeding. Then I'd also like to go over ear drops that are used after tubes are placed and the potential need of water precautions. So when we talk about the anatomy of the ears, I like to break this up into three quadrants, three areas, specifically the outer ear, which is the ear that you can see, and then the ear canal. At the end of this is the eardrum. Just under the eardrum is an air-filled space called the middle ear. Deep to that is a bony space where the organ of hearing or cochlea is housed. And so the eardrum itself divides the outer ear from the middle ear. When an ear tube is placed, an incision is made in the eardrum. It's actually placed in what we call the anterior or the front, inferior or bottom part of the eardrum. The bones of hearing are actually kind of in the back portion of the middle ear space, and so we place the tube down in the anterior inferior quadrant to try to keep it as far away from those as possible. Now the tubes are really small, so you really won't be able to see them unless you had an otoscope, which is used to look at ears. And because of that, there's really no danger that you're going to touch the tube, with a finger or honestly even with a Q-tip or anything like that. They're so far down, there's no concern that you're going to hit the tube. So after tubes are placed, typically the pain is quite mild or self-limited. I usually will tell parents that most kids are back to normal by lunch or dinner time. Really for pain management, if there is much pain, it's recommended that you use ibuprofen or Tylenol. Most of those are things that you would have already at home. Every now and then a child will have a little more discomfort than usual. Occasionally this is because the ear was infected at the time that the tube was placed, and so there may be some more inflammation or pain from that. In that case, again, you're just usually using the Tylenol and Motrin, but may need to do it for a little bit longer and do it a little bit more consistently. Generally, if the ear is infected at the time of surgery, your surgeon's going to let you know that, hey, it looked infected, and know that there may be a little bit more pain involved. Now, if despite using the ibuprofen and Tylenol, the pain seems to be more excessive than what's anticipated, of course I just recommend that you stay in touch with your surgeon's office. So drainage after tube placement is really quite common, especially if there's fluid underneath the eardrum at the time of surgery, which honestly is often the case. Now the drainage can vary from a very thin liquid like water all the way to really thick mucus, almost like a gummy worm consistency. Typically this decreases over a few days after the tubes are placed, and if it persists longer than that, 2 or 3 days, then I would recommend contacting your surgeon's office. Bleeding from the ear after placing a tube is also not uncommon. Typically it's a really small amount that you might see on the cotton ball that's placed, and obviously it's related to the incision that's made where the tube is put in. Occasionally if the ear is inflamed, if it was infected when the tube was put in, you can see more bleeding than that. Again, typically this is going to be self-limited and will decrease over 2 or 3 days after surgery. If it's more in volume than you anticipate, though, if you feel like you're changing the cotton ball every 10 minutes or more, then I would contact your surgeon's office. Now the key with drainage or bleeding is collect it with cotton balls, kind of keep it from, of course, running down your child's ears or over their cheeks. But really the key is using ear drops. That's what you do. When in doubt, use ear drops. The ear drops really do two things. First of all, they're an antibiotic drop generally, which would fight any infection that may be there. So that's one good thing that they do. But the other really important thing that they do is they keep everything liquefied, whether it's the drainage or potentially bleeding. They keep that liquefied, which helps keep the tube open. One of the fears that we have as surgeons is that an ear tube that we just place under a general anesthesia gets blocked. And if it gets blocked, it's like it's not there, it's not functioning, it's really not working. So Again, when in doubt, we recommend using eardrops. And again, if questions, contact your surgeon's office. Now, when it comes to water precautions, over the years, the recommendations for this have changed. In the past, potentially as adults, when you may have had ear tubes, usually the recommendations were to be quite strict against water, swimming, bathing, things like that. Thankfully, now the recommendations for this have become much more lenient, and that's because studies have been done more recently, which have shown there's really not a problem with swimming, bathing, and those types of things with ear tubes. The tubes, thankfully, their lumen or the hole is so small that water just beads up on the outside of the tube. Now, there are some caveats to this. Diving in really deep water, where there's a high pressure, that potentially could push water through the tubes. Also, very soapy water like bubble baths potentially could allow water to move through tubes. But in general, there's no water restrictions, no need for avoiding water, no need for avoiding swimming, no need for the earplugs, no need for the neoprene headbands from what we've seen on recent studies. I will say that despite that, there are some surgeons that still have a preference to avoid water. So again, please go by the recommendations of your individual surgeon. All right, everyone. So hopefully this video was helpful in answering your questions. Certainly, again, if you have other questions, contact your surgeon's office. Feel free to subscribe to the channel to receive updates on future videos. And as always, until next time, keep your nose clean.